There's growing concern about a bowel infection outbreak in Hammanskraal outside Pretoria. 6 people are now known to have died from this, with close to 70 others currently being treated for symptoms relating to diarrhoea, stomach cramps and vomiting at the Jubilee District Hospital. The Gauteng Health Department says teams will be dispatched to assess the situation. Katleho Sekhotho is in Hammanskraal and she joins us now for more details in terms of what more we know. Katleho, good morning.
A very good morning, Dudu. Indeed, we are here at the Jubilee District Hospital in the Hammanskraal area, where we have heard from the Gauteng Health Department the outbreak of that diarrheal infection or diarrheal disease. A number of patients coming to this doorstep of the facility seeking medical attention. And what we know is that a number of patients, or about 50 people, according to the department, between the 15th and the 19th of May, so around about last week, came to the hospital seeking medical care, all presenting symptoms of watery diarrhea as well as stomach cramps and vomiting. And unfortunately, since then, we have been informed that 6 people have passed. And so that number did steady climb overnight, because we were initially told that about 52 people were being treated at the hospital. And early on this morning, we were told by the department that about 67 people are being attended to at this facility concerning this outbreak. But I do have with me Dudu, the matron of the facility, matron Julia Apani, just to give us more details. Matron, thank you so much for giving us some of your time. We heard about this outbreak. Just as a facility, what have you seen and how are you dealing with this matter?
Thanks a lot. I'm Matron Apani, senior matron here in Jubilee District Hospital. Like it has been said, we had several cases, reported cases coming to us from the surrounding area with complaints of stomach cramps, complaining of diarrhea, loose stools, some complaining of vomiting. And it was both the mothers, the fathers, the children that were reporting to our health facility, starting from the 15th. It was never a mob, it was just people that were coming in drips by drips. But to date now, like we already said, we've got 67 confirmed cases that came here, but we are not aware specific of what bacteria are these people suffering from. Yes. They are just presenting with symptoms of gastroenteritis. They are having diarrhea, vomiting, and stomach cramps. Yes. And like we've said, we've got 67 cases reported, and to date we've got only 7 people that passed away in our hands. Thank you.
Matron, in terms of managing the situation, is the staff complement enough to manage the number of people who've come in so far?
The staff that we had a challenge with, that they were enough for our normal routine nursing management of our patient or service delivery, but we had a little bit of a challenge when a large number of people were coming in, especially our lower category of nurses, our enrolled nurses, our enrolled nursing assistants. But we had, with the CEO, agreed that we are now going to get people to coming in to work overtime. We had volunteers that came in. Overnight, we had some of our ComServs that were off. They came in and assisted overnight because we couldn't manage at all. It was just a lot in casualty, lot number of patients in casualty. Yes.
If the number does increase, matron, would you foresee problems in terms of staff, or will there be provisions made? Will those conversations happen in terms of how you can manage if the numbers increase of patients?
I think now the response is good. Like last night, we had enrolled nurses coming as far as Tshwane District Hospital. We had one that was reported to me that came from Reference Clinic. They are now it's no more a Jubilee hospital issue. It's now a district issue. And we are really glad about that. Whatever hand we can get, we are really comfortable with that. But also our staff inside, we said they must come for overtime, and of which they are reporting in. Thanks a lot, my dear.
Thank you very much for that, Matron. Dudu, there you heard it from the matron, just outlining how the facility is trying to mitigate the situation, really asking health workers to, put in a bit of extra time there over time to manage the number of patients. But obviously, it might be a conversation of additional assistance from the department should the number of patients increase at the facility, or a number of people come in with similar symptoms, and that will be a conversation about how they deal with this outbreak.
Katleho Sekhotho coming to us from Hammanskraal. Thank you very much for that report.